Hi everybody, and thank you for watching and also for your interest in our paper, Use of Multiparametric Magnetic Resonance Imaging and Fusion-Guided Biopsies to Properly Select and Follow African American Men on Active Surveillance. My name is Jonathan Bloom, former Urologic Oncology Fellow at the NCI and current Assistant Professor of Urology at the University of Rochester in Rochester, New York. Our study wanted to answer the question if African American men selected for active surveillance in our current era with multiparametric MRI and fusion biopsies fared any differently than their Caucasian counterparts with similar disease. Many urologists are embracing active surveillance as the recommended treatment for low-grade Gleason Grade Group 1 prostate cancer and even select low-volume Grade Group 2 disease. However, there is some controversy surrounding whether African American men are at higher risk of progression. Prior studies before the era of MRI and fusion biopsies have found higher rates of adverse pathology in African American men. Furthermore, some studies have found a 3 to 4-fold higher rate of progression in African American men on active surveillance as compared to white men. This brought us to a few questions. Could this simply be due to upfront missed disease in these men? Is it an issue with access to healthcare? Or perhaps African American men do have a more aggressive phenotype and clinicians should be hesitant to offer active surveillance. The benefit of fusion biopsies is that we can more accurately stage men for both definitive treatment or active surveillance. With MRI and fusion biopsies, urologists can detect up to 30% more high-grade prostate cancers as compared to systematic biopsies alone. These cancers are often in difficult-to-sample areas, such as in the apex or anterior portion of the prostate. These anterior tumors have been shown in some studies to occur more often in African American men. We first wanted to look at the upgrading rate of all men referred to the NCI with a prior diagnosis of low-grade Gleason Grade Group 1 or Grade Group 2 prostate cancer on prior systematic biopsy. Of these potential active surveillance candidates, we found that African American men were upgraded more often, 25.6 versus 14%. When looking at Grade Group 1, African American men were upgraded 22.2% versus 12.1%. Our data led us to believe that systematic biopsy alone undergraded many men with prostate cancer, especially African American men. As an example, this is a 61-year-old African American man referred with Grade Group 1 disease in 1 out of 12 cores. He sought out a second opinion regarding active surveillance for surgery. MRI showed multiple PI-RADS 4 lesions, and after targeted biopsy, Grade Group 5 disease was found. It's unclear why systematic biopsy understaged more African American men than Caucasian men. One theory is that African American men may present more often with anterior tumors. We looked at our rates of anterior tumors after selection for active surveillance with MRI and fusion biopsies and found similar rates. In this way, all of our men beginning active surveillance start on a level playing field. We then looked at the Kaplanmeier curves of each group and found no statistical difference. Median progression-free survival was 59.7 months compared to 60.5 months, and median time continuing on active surveillance was 61.9 months and was not reached in the non-African American group. So from our paper, we concluded that African American men had higher rates of upgrading from Grade Group 1 to Grade Group 3 or above, 22.2 versus 12.1%, after confirmatory fusion biopsy, and we feel that missed disease may have been a contributor to prior studies that have shown African American men to have higher rates of progression while on active surveillance. With MRI and fusion biopsy, we can mitigate some of these risks of missed disease, and all men with true low-grade disease can be offered active surveillance. Once these men were on the quote-unquote level playing field, we saw no differences in grade group progression or time continuing active surveillance. Thank you for your interest in this video, and thank you for the British Journal of Urology for publishing our work. Feel free to contact us with any questions, and make sure to follow our group on Twitter. Thanks again.